we used to meet in person, and one of the things we did was to go around the whole room, and we learned a lot of people who are doing wonderful things with folks who are vulnerable at all stages of the kinds of things we do. So some people have been doing this kind of work for 40 years, and some people just started a few weeks ago. And so we have all kinds of talents and resources to present and share with one another. So just briefly, if anybody is new today, just if you haven't met me doesn't mean you're new, but if you're new today, if you could unmute yourself and introduce yourself just with your name, and if you're associated with any group, to say that so we can have a chance to know how to connect more with you. So just raise your hand or just unmute yourself and let us know who you are.
Well, I guess I'll go ahead and get started. My name is Gerald Williams. I am the shelter manager for the Tacoma Rescue Mission. I'm sitting in for Luis and Nate today, who couldn't be here. So this is my first time because I didn't even know how to unmute myself. So that's a good thing.
Good thing. Welcome.
Thank you.
All right. Well, thanks. Welcome, Gerald, for being here. And so if anybody else is new here, we will have some discussions in small groups and some presentations. You're welcome to stay until 11. And at 11, we have a group. Anybody can stay to help us plan for next week. It's an open table. We're all welcome. And at 11, the magic will stop, but the planning will continue.
The pre-magic.
Pre-magic, yes.
So to kick us off this week, I know we were going to have our This Week on the Streets update. And I believe this was going to be Nora Leiter from the Catholic Worker.
Yes.
Yes, I should have introduced myself with the new people. It's been a very long time since I was at this meeting. But I understand, Rosemary, if this is correct, to just talk a little bit about what we're doing and what's different since COVID has started. Is that correct?
Yes.
Yes.
So the brief picture of what we're up to, the Catholic Worker has been around for about 30 years. And our main focus is transitional housing for folks who have been coming out of shelters or living in their cars. And also folks who have been released from the Immigration Detention Center. Now, there are very, very few people being released right now, but that has fluctuated over the years. So right now, mostly we have people who have been staying in the shelter or living in their cars, who are living in Guadalupe House, the central house in our organization, our community, for typically about 9 months. It often stretches more, but that's what we plan for. And folks who are living with us are saving money and are working with staff members each week to look at their goals and plan for getting a job or working on mental health, working on their future stability, building a network for themselves as they move on in the future. And so one of the other things that we do is weekly provide a meal and an open house, which is partly about providing food, but really much more about providing some community and connection and a chance for people to sit down together week after week and get to know one another. Folks who have been on the street, but also people who are supporting our community are present at that meal. And that's something we've had to cease altogether during COVID. We didn't know a way and couldn't find a way to serve what was typically 50 or 60 people a meal and sit together safely. And so that's something that we've put on pause until COVID is done. Until restaurants can seat people safely, we figure we're really not an exception. What has continued is the transitional housing. And we've made some small changes, which include having a COVID test for folks before they move in and for the beginning period of their time living with us to be more isolated. We've had to make a plan for if someone tests positive in the house, and the health department's been incredibly supportive in that. We haven't had any positive tests so far, thank goodness, but we do have our procedure in place, and have had to test it a few times when people suspected that they might be ill. But that all has resolved really well. We have also found that there's greater need to be connected with and support the people who are camping on our block and kind of in our immediate neighborhood. There are many, it fluctuates so much from one week to the next and always has. But we find that during some periods, particularly in the summer, we were having a really large camp in our neighborhood. And our main strategy was to talk with those folks as much as we could to find out what they needed and to work with them as much as possible to meet the needs we were able to meet. And that meant that we added a lot of trash cans on the street because people did express that they wished to have a place to put their trash. They didn't want it in a pile on the street. There just wasn't anywhere for it to go. We've always had a water fountain that's kind of outside of our garden for anybody to use, but we decided we needed to modify that to make it safer to use for people who were filling water bottles. It was one of those really old, like you would have in a school, you know, a little water fountain with a button on it that people had to hold their hand on while they were filling something. And we've modified that to make it much easier to fill containers, which is most of what people were doing. Let's see. It really has the biggest shift, I think, is the way that we've become much more intentional about meeting the people who are living outside and figuring out a way to support what they need more regularly. And everyone sees the camping that's going on everywhere. In our neighborhood at this particular moment, there's a little bit less than there was 2 weeks ago, but we know that that changes. So that's most of what we're up to right now. Of course, we're having our meetings outside. We're wearing masks in the house, all those ordinary things. So far, so good.
So does anybody have any questions?
What are the most frequent needs that folks that are in your neighborhood express to you?
The folks who are outside, very often blankets, but also we had a series of meetings as safely as we could in the summer to talk about what was wanted and needed. And one thing that came up pretty regularly was a place for people to cook. And that's not a need we've been able to meet in an organized way outside at this point. But it's something that came up really regularly. The things that were simplest, we went ahead and did. Place to put trash, better water access, bathrooms, always.
Were you able to accommodate bathrooms?
We really worked hard to have a conversation about that. And we're not able to settle on a place and a way. We hoped in the summer, and we really hope in the future to be working on changes that are with the people who'd be using the services. So we began forming a schedule of folks living in their cars or in their tents to be the people tending making sure that the porta potty was useful and safe and clean and all those things. That did not come to its conclusion. And that's partly because we are half a block from Nativity House. And Nativity House has several porta potties in their parking lot. And as kind of an interim measure, they are, I believe at this point, still opening the gate that has a staircase between G Street and their parking lot and making those available more often. Our main question was, where do we put it? And how do we make sure that each day it's clean and safe and usable? And how do we do that as a cooperative effort with the people who are going to be using it? And that the pressure of that kind of came off as we found this other alternative. That was going to be the hardest one, and one I'm sure we'll still be looking at in the future.
Thank you. Any other questions before we move on in our agenda? Well, thank you very much for the update and perspective from what you've seen in your corner of the neighborhood.
Thank you also.
All right. So our first presentation in today's agenda, like to welcome Jax Hermer from the Tacoma Pierce County Health Department. Jax, did you need to present slides at all? And if you do, I can make you a co-host.
That would be great. Thank you so much.
Okay, let me do that here briefly. And if
Hey,
you
good
want to
morning,
just introduce
everyone.
yourself.
Yeah. Hi, everyone. My name is Jax. I am a nurse at the health department. I'm in communicable disease. I'm an advanced practice nurse, and I'm on a team of folks who are helping respond to COVID. And I work with Carrie Ching, who you all know and love, and we're involved in how really educating folks who are at increased risk and disproportionately burdened by COVID. And so I'll just be presenting today on the latest information and make sure we're all up to date on things. I'm sure some of it is very familiar, and maybe something will be new, but there'll be time for questions. Okay, I'm going to share my screen. Okay, do you see my notes section, or do you see the main screen, the main slide?
Seeing the main slide.
Great, wonderful. Love when that works out. Okay, hi. So let's talk about what we're seeing in Pierce. As you all have heard in the news, COVID is out of control currently across the country, and in Pierce County and King County and Snohomish County and across the state. So right now we're seeing higher case counts than ever before, close to twice as high as the highest peak that we last saw in the middle of summer. That's very overwhelming and scary. And basically what we're looking at here are daily case counts, not rates, case counts in Pierce County. The first wave that you see was when the pandemic first hit Pierce County, and then we put in place the stay-at-home order, and cases went down significantly, and then just like leveled off for a very long time. And then as we opened into phase 2 in the Safe Start guidance, people started being more liberal with their activities and cases crept up. And because our cases are so high right now, it looks like that was a low bump, but this was extremely stressful and a huge deal when this was happening June to July. These were really, really high case counts and very overwhelming to our system and our hospital system, and a significant growth of cases among younger folks, particularly between 20 and 40. We didn't see as many deaths in this phase, but we just saw a huge amount of social gathering, and then we put into place mandatory masking laws, and cases went down. Masks are very, very effective, and you can see this downward slump as a direct result. However, since really Labor Day, people have been much more liberal with their activities, are not wearing masks regularly in public, are going more regularly into stores and restaurants, and in having people over to their homes, and having social gatherings. And so this dramatic increase in just indoor gatherings is what we're seeing right now, causing a very intense increased spike of cases. So we also have continued to see disproportionate impact of COVID across different racial and ethnic groups that are directly related to experiences of racism, discrimination, and stigmatization in our society. People who are Black or Native American or American Indian or Alaska Native have twice the rates of COVID compared to white people in Pierce County. People who are Latinx have rates about 2.5 times the rate of folks who are white, and folks who are Native Hawaiian or other Pacific Islander have rates about 4 times the amount of folks who are white. So we are paying very close attention to these trends and doing our best to work with communities impacted to try to understand and adapt our practices as a health department to better support these more vulnerable and highly more impacted communities. So a little bit about you and protecting yourself. In general, you can prevent COVID by keeping gatherings small, by wearing masks, washing your hands, covering your face when you sneeze. You should keep 6 feet distance from everyone outside of your household, especially indoors, but outdoors as well. You should be wearing a mask anytime you're around someone who is not in your household. Masks are very effective. Airflow. So, if someone was ever in your home that isn't in your household, hopefully you can keep that time limited, ideally less than 15 minutes. But if they are inside, everyone is masked, windows and doors are open, air purifiers are going, anything to keep as much airflow as possible to dissipate the impact of COVID stained elevated in the air at your face level. Now, you should get tested if you have any new symptoms of COVID. That includes lack of taste or smell or sniffles or coughing or a tightness in your chest. Or if you've been around anyone outside of your household for an extended period of time and they tell you that they've been sick, whether it's with COVID or something else. But if you think you've been a close contact of someone that has COVID, you should seek testing. Ultimately, it is up to your healthcare provider to determine whether or not you get the test. Right now, we are not looking at a testing shortage, and so it's an excellent time to seek testing. You can get tested. You can reach out to your healthcare provider. You can reach out to community healthcare that's taking folks that aren't their patients and don't have insurance. Or we have a number of different testing sites that we regularly update weekly on our website. So the website to get our community testing sites, which are free at cost COVID testing, is tpchd.org/COVID test. And again, we update that weekly. So we've heard a lot about the COVID vaccine. We know that Pfizer-BioNTech just put out a press release last week that they found some very promising effectiveness results. That is very exciting. I want you all to know that Tacoma Pierce County Health Department and the Washington State Department of Health, which we are following their lead very closely, are very committed to only promoting a vaccine in Pierce County that has proven to be safe and effective. So we are not going to be swayed by politics. We are really going to only promote the vaccine that we truly believe to be effective to stop the spread of COVID. We also know that there is going to be a dramatically limited amount of supply of the vaccine when it is first released. So maybe we will see some vaccine this year, but the people who will be able to get it are the people who are most impacted by being exposed to COVID. So those are first responders and healthcare workers that directly work with people who have COVID. That is going to include not just your nurse or doctor, but the janitor or the aide or the community health worker that is directly working with the folks who have COVID. The state has led an effort to really do a lot of community research and get community input on how to create an allocation and prioritization plan rooted in equity. And then folks who live or work in long-term care facilities that are over the age of 65 will then will also be prioritized in that very first phase of who gets the vaccine. And then at every phase going forward, it's very much rooted in who is most impacted and who is most vulnerable to the disease. but we imagine it will be some time before the vast majority of the population has access to the vaccine. So if we, and I don't want to give you any timelines because we really don't know, but just know it's going to be a slow rollout because we're looking at very little vaccine available when a huge amount of people fit into this very first category of who might be eligible for the vaccine. Another really important thing to keep in mind right now is that we're in flu season. Luckily, we haven't seen a lot of flu yet in the community, and many of the things that we're doing to prevent COVID are effective at preventing the spread of flu. Influenza and flu mean the same thing. Influenza in the past causes more hospitalizations, deaths, and illness than any other vaccine preventable disease. So in Pierce County last year, we lost 13 people. The year before, we lost 42 people to influenza. The same people that are more vulnerable to COVID are more vulnerable to influenza. So we need to continue our really rigorous efforts to protect our more vulnerable populations so that we can keep and protect our community and families safe. Now, the issues that come up for us around flu and influenza are that it is extremely challenging to determine if you have flu or influenza. So if you have any symptoms like flu or influenza, you should seek testing, and your provider will help you determine what steps to take. If at any point you're feeling short of breath and you're feeling at risk, you're feeling uncomfortable, you're feeling at risk for your life, you should seek emergent care right away. Our number one priority is to reduce the spread of influenza in the community as well as COVID so that we can not increase the burden on our healthcare system. The more people that need our hospitals means the less people that can access them when they need them. So the number one thing we can do as a community right now is get our flu vaccine. It is available, it is effective at preventing, reducing the severity, and shortening the duration of flu should you get it. The more people that have the flu vaccine, the less likely and less easy it is for flu to jump from person to person in our community. The less hospitalizations we'll see, the less impact on our healthcare workers and healthcare system, and we'll just be able to have fewer deaths in our community. You should not get the flu vaccine if you think you might have COVID. That is not because they can't be taken together. It's just because we want to protect our healthcare workers and not further their exposure to COVID. It is available now. You can get the flu vaccine from us going to tpchd.org/flu. We have many different flu clinics across the county that we can give to you. It is free for children. It's free if you have health insurance, and if you don't have health insurance, you can come to us and get the vaccine for free. Lastly, the COVID pandemic is a really, truly trying time on all of us, and our interconnectedness and interdependence is more real and present than ever before. And so what we can do for each other is staying home, getting these vaccines, and reaching out and caring for one another, staying connected even when we're physically apart. So thank you for everything you are doing for your communities, for your networks, for your families. Thank you for helping us stop this pandemic. And this is my email address. You are welcome to send me questions, and we have time now for some Q&A.
Great. So if anybody has questions, feel free to unmute yourself, or if you want to raise your hand and do it that way, or put something in chat, those are options too.
What's the current turnaround time to get the results of the COVID test?
Yeah, so depending on where you get tested, but on average about 24 hours right now.
I have a question. What are you guys doing to reach out to the communities of color on regards of education and prevention?
Absolutely. So we are, just like this meeting, we are regularly going, we have a team of cultural liaisons from the communities most impacted by COVID that are regularly present in community coalition meetings and community network meetings, sharing updated information about COVID. We also have funded 12 organizations rooted in the communities most impacted by COVID and are substantially paying them to adapt our public health messaging and tools to be more effective and resonant and grounded in their language and network and community and culture to educate their community.
On those lines, could you provide a list of the organizations that you guys are working and paying to do the work? For example, for the Latinx community, I would like to know who is the liaison and which organizations are the ones that are doing the work.
Yeah, I wonder if, Carrie, are you there? Is this something that you could help with?
Yes, I can help you, Sarah.
Thanks.
And any other final questions for Jax? I see Jan with her hand up.
I think we're reading that the mortality rate is going down, which is not seen by some as a reason to be less cautious or even believe that the pandemic is real. Can you speak to the new data that is arising about folks who survive the disease of COVID, but not surviving well? It seems to be that data is coming out about long-term, perhaps permanent effects, neurologic and stuff like that. So I am really afraid of the messaging of the mortality rate going down, and therefore it's no big deal. So can you speak to that, please?
Yeah, great question, Nurse Jan. I think you hit the nail on the head. It is true that rates are increasing among younger folks who tend to survive COVID. And we have put in place such strong precautions in long-term care facilities that rates of mortality have gone down. So if you don't know, initially we saw COVID breaking out in long-term care facilities that predominantly housed folks who are over the age of 65. And as such, we've seen the vast majority of our deaths among older people. And now we see our rates of COVID among younger people who are generally healthy, but folks are surviving and continue to feel very sick for a very long time. It is taking a real toll on quality of life. It leads to significant amount of chronic fatigue. It is an inflammatory disease that is having a very long effect on people's ability to feel active and engaged and thinking clearly again. And so it is true, while it might not take away your life, it is impacting on a very long term the quality of the life that you have once you have it. So great point. This Department of Health, I don't know if you all get both, this is such an excellent time to make sure that you're signed up to your local public health websites. And so I'll put in into the chat some links for you to sign up, but it's a great opportunity to be getting messaging and press releases from the State Department of Health, which is right now has a real campaign on sharing the story of a woman named Susan, who's my age in her late 30s, who is really struggling with the long-term effects of COVID. And then for us, we're putting out regular blog posts about, just like how to stay safe if you're gathering for the holidays, and getting updates on new illnesses should they be coming up, like we were really concerned about this multi-system inflammatory syndrome in children, which is the effect of COVID, even though on young children who, even though may not have gotten very sick from COVID, are having very serious inflammatory reactions to having healed from COVID, that isn't necessarily taking their life, but is causing months and months of recovery, because it is literally shutting down most of their systems. So there is much to be scared about with COVID.
Teresa, you had your hand up.
Hi, I'm sorry I don't get. I'm in Oregon. I'm on the Oregon coast, and I have a low bandwidth, so hopefully I don't get cut off. I want to say the health department, the Pierce County Health Department, has done a great job of putting information out there that's easily accessible and beyond the mailing list, these few regular updates. I haven't gone to check for this yet, but I'm hoping you have that chart like popping in people's faces the minute they hit your website. And also, I wonder if you have really conveys to people the difference between.
All right, Teresa, you cut all the way out for some reason.
Sorry, Teresa. I'll make sure my email is in the chat and you can email me your question.
Excellent.
I've got something real quick, if it's okay.
Mm-hmm.
So my name is Nate. I work in the homeless outreach team at Comprehensive.
Did you say you work in the health department?
No, homeless outreach at Comprehensive.
Okay.
I might have accidentally said
like,
it. Sorry.
Oh, hey, what's up?
Yeah, right. Hey, how's it doing? So, like it's pretty well known that like studies of poverty and sickness go hand in hand, right? So are there discussions being had about distribution of vaccine to more vulnerable populations, specifically, obviously, as this is the Coalition to End Homelessness, right? Our concern is homeless people, right? Who have demonstrably worse health outcomes to most folks, and would probably, I would hope, be stacked pretty high on the rate of who's going to get like early access as far as the general populace goes. Is there any discussion of that happening?
Yeah, I'm going to show you a special thing that no one in the public has seen. It is not confidential, but please don't screenshot it because it's going to change. But I just think it's important. So do you all see this one slide that looks like a blue wave? So this right now is the current plan for how we will be distributing the COVID vaccine. It's going to change. Please don't screenshot this, but it's taken from the Framework for Equitable Allocation of COVID-19 Vaccine from the National Academies of Medicine. This is, and then informed by over 17,000 respondents of a survey and 400 respondents of focus groups and key informant interviews that the Department of Health conducted between October, really September, October, November so far. And so equity is going to be the driving factor behind how we distribute the vaccine. And we are also weighing like impact of the physical impact of COVID, the risk of exposure to COVID. And here, let me use that exact language. So sorry, give me a second. These are, so I don't even know if I can tell you. Anyway, yeah, here we go. So it's based on the highest valued, the risk of severe morbidity and mortality, the risk of acquiring the infection, the risk of transmitting the disease to others, and then the risk of negative social impact. And so these values, in addition to who is most impacted, are all being weighed. I'm so grateful to not be in the room making these decisions. It is a horrible ethical quandary, but ultimately what is mostly being decided at this point between all of the different independent bodies that decide vaccine and decide how vaccine will be distributed is that we're first going to see high-risk workers in healthcare settings and first responders, and then people in long-term care facilities, people with, and then through that web, like people who have disabilities, people who are homeless, people who are in prison, people who are Black and Alaska Native and Native American and Native Hawaiian and other Pacific Islander are going within those groups will be prioritized first. So you're going to see a lot of like, how at risk are you? Let's get you the vaccine first. But we are also experiencing, I'm going to take this away before I get in trouble. But we're also experiencing that, you know, like people are scared that even the distribution of the vaccine is going to be another clinical trial of the vaccine. And so we are working with a significant amount of resistance and fear and mistrust. And so we are really going to rely on you all as our community partners to be helping promote the COVID vaccine, because it is going to be the most effective way to stop the pandemic when it is available.
Well, thank you so much for the presentation. There's a lot of great information there. I see Teresa has posted.
Yeah, I'll send you I'm going to put in a bunch of, you guys keep meeting and I'll put in a bunch of resources into your chat box.
Awesome. Well, thank you very much for making time to come here today.
Absolutely. Thank you so much for inviting me. I really appreciate it. You all have a great day.
And you as well. Stay safe.
Thank you.
So I'm going to do a little audible on our schedule and shift the safe parking update to be next. So Jan and Colin, did you want to kick that off?
Yes, if I can go first, because we've got some great news. You know, every once in a while on the road to Damascus, you meet a reverend that shines the light. So Colin was able to have a Zoom meeting with a couple of leaders, masters in the practice of faith, who absolutely gave an amazing boost to our effort. And so Reverend Boyce is going to just take a couple of minutes because he has to leave, but I'm going to let Reverend Boyce just introduce himself and the impact he's had on the work we do. So take it away, Reverend Boyce.
And you are muted right now, Mr. There you go.
Yeah. Hello, everyone. Some of you I know, some of you I don't. I did spend some time working with Associated Ministries on their quarterly community meetings. I am the missioner for homeless ministries with the Episcopal Diocese of Olympia. That's 103 parishes and missions in Western Washington. I'm also on the bishops. I head the bishops' homeless task force, which we are promoting a lot of the ideas that came from HB 1754 to all our churches in Western Washington. I worked with Bill Curlin Hackett for 2 years in getting HB 1754 through Olympia. And as of June 11th, 2020, that bill has passed. It is now active. I would highly encourage everyone to get a chance to read it because it sets a ground floor where churches and communities can start working together at housing the homeless on church property. This has been a hard fought to get this through, but when it did, both sides of the aisle in Olympia were proud of the fact that they worked together on getting this bill passed. And I really want to pass that on. This was a ecumenical and both sides of the aisle effort to get this done. It does, somebody asked, do pre-existing local ordinances still apply? No. This overrides all previous issues. If there are any problems with a local community, please reach out to me. I will be joining you every Friday at 9 o'clock in order to throw my voice in here. I would highly encourage everyone to start talking to your pastors and rectors about, what can we do to help the homeless. So many are still living in tents on curbs and in the woods. Let's give them a safe place. And now we can use churches to do that. Churches have been pushing for this for 30 years. And now we have the tool to do it. And I would highly encourage everyone to look into this. And just to let you know, I'm at Doyle's right now where I will be meeting Bill Curlin at 10 o'clock. So it's just a matter of him sitting down at the table with me.
Well, thank you so much for joining us and for the update and for all of your work on this. I think this could be really transformative.
Jeff, are you sure you're not Catholic if you're meeting at an Irish pub?
I'm Episcopal now. Me and the Catholic Church had our discussions a long time ago.
Colin?
Yes, well, I would just like to say thank you to Jeffrey and Bill. As mentioned, as Jan had mentioned, we had just a great meeting with them earlier this week. And just they really shined the light on a lot of things around this. Definitely gave us some energy and some direction. After that meeting, I would say that we also had a meeting with the county, some county leadership, just to discuss the House bill, be transparent with them, let them know that kind of moving forward, the hope is that this will kind of be our guiding document. Honestly, a lot of what we would have, what the county or any cities are going to require us to do, or ask us, or what we as the Safe Parking Network, we're going to require ourselves to do, all aligns with this as far as background checks, no sex offenders in the place, having some very basic rules, social distancing. It even goes a little bit further than I think what we would have done. So I don't think it's by no means is this some loosey-goosey, just, we're going to start setting up safe parking all over the place. I think this just gives us some foundation, as Jeffrey had said, and some guidance. And truly the hope is, as the county and as the city of Tacoma has said on multiple occasions, they really want to be a partner with us in this. And honestly, I think on all ends, it just makes the process a whole lot less onerous. And if, as we've talked about before, if this is genuinely something that we want to do in our communities, this just gives us a pathway and a process to do that without jumping through many of the hoops that we potentially could have jumped through if we were going to have to set up, kind of try to shove this through an ordinance that, or a temporary use permit that really doesn't align with safe parking. So we're really excited about this. Another example I would say is we still, there's full intention, and it's called out in the ordinance or in the bill. You still need to, contact the neighborhoods, go through that process, have a community meeting. So these are all things that will still most definitely be in place. So yeah, I just say thank you to Jeffrey. I think I'm really excited to have him to lean on now, and I'm going to lean pretty heavily, possibly at Doyle's. And also Bill has just been great with this also. So, I know Jan and I were really excited about it. And, outside of that, what I would say is we talked to 2 more churches this week. So as I've kind of said for the past few weeks, we're getting upwards of around 8 churches, I would say, that are talking. pretty spread out evenly. And now it's just a matter of, we still have a couple of them. I've kind of shared this information, some of this ordinance information, told them to look at it. And we're just kind of seeing what the next steps are going to be. So really excited for what comes next. And I guess I'd say that's about it. Jan, I don't know if you have anything else to add.
One last piece is that the language from House Bill 1754 was sent to Lakewood, City of Lakewood. All the council members, the city manager, the chief of police, and the mayor. They immediately responded with that the City of Lakewood officially does not allow safe parking, with the exception of, and then they copied and pasted the language from 1754, said they would immediately abide by everything in 1754, particular to safe parking, and early in 2021 will codify the language of 1754 into the ordinances of the City of Lakewood. It was amazing. It was just amazing. And I give a lot of credit to Colin, who's kept his ears open for every possible angle on approaching this particular issue. And in doing a little bit of research, I think Pierce County is one of the last of the larger counties of Washington to even think about safe parking. I think we are slow coming to the table. And so I'm proud of this coalition, Colin and everybody else who's taken a different approach to handle this particular social determinant of health. And with that, this public health nurse will mute.
One question I had is, has there been any conversation yet with the city of Puyallup?
There has not. So today, I drafted up an email. I'm going to send it City of Puyallup's way, try to schedule a meeting with them. I've talked to the church in Puyallup and the involved leaders in Puyallup, and just kind of giving them a heads up on this and pass them along the information on the bill. So I'm hoping to talk to them, and then I'm also going to reach out to the city of Tacoma and try to set up a meeting. We've already done with the city of Tacoma, and it was positive, but this shines a new light on the city of Tacoma conversation. Is exactly what this bill is about, because we met with the planning department and they were scratching their heads saying, I don't know where this fits. This doesn't really, I guess we could try to do this. We could probably pop it in here. So I think it's an to me, it's exactly why we have a bill like this. It kind of cuts all of that out. So those conversations are definitely to come. I would say to Jan is, real quick to give a lot of thanks and props, and without Jan behind me poking me in the back at most all times, we wouldn't be where we are at. So not just Jan, there's everybody in the Safe Parking Network group, and someone asked for information on it. If you want more information, email me. I'll put my email in the messages, and we'll get you added to that list. But it's every Monday at noon. We have a meeting this Monday. The last thing I would say is we have who's on it this week? Oh, Dr. Pruss. So another just expert who's done 10 years. He's going to join us via phone, but we'll be in a Zoom meeting. He's going to be driving to California to get back to his studies. So that's all I got.
Fantastic update. Yeah, Maureen.
Great work. Wonderful. One thing to keep in mind, Lakewood was really important because the mayor of Lakewood is one of the special advisors to the county executive. And one of the things I would think about when you go out, one of the things I would think about when you go out to the other jurisdictions, I would quote what the city of Lakewood has told you. I'd literally attach that, because these mayors are all working together on the housing side in that SHAPE group. And so I would freely share what they're committing to. something to think about.
Yeah, it's a good idea to send that language to all of the mayors in the SHAPE group. I encourage you to do that.
Fantastic. So any other last comments before we move on to our brainstorm session? All right, thank you so much. So, Kevin.
Yes, Rob, I am here. So this kind of ties in nicely with what I was hoping to have us look at in our breakout session today. But before kind of outline that very quickly, I do want to just give a bit of an update. I've been talking with a couple of agencies, and it looks like we have one that is willing to take on the inclement shelter voucher program, hotel voucher program, which we're working to get funded as well. So hopefully we'll have more news on that next week. But at least that would help us on inclement weather days, having access to some other beds. The second thing, and I've talked to Michael Yoder about this, and I've talked to a couple others, is how do we approach churches? And this is an idea that I got in a conversation with Nick Leiter. And I don't know, Nick, if you are now you or if you're still your wife, where it has your name there. But of trying to, how do we approach local congregations? Not just, I mean, Colin and company are doing the safe parking, but the idea of approaching congregations about accepting one family or one household if it's an individual, and making a commitment to provide supportive housing to them until they're able to move, you know, as they're going through the process to get into more permanent housing. And so how do we make that outreach to churches? And one of the things that we're really looking for, and I'm going to thank Mike Yoder for this. He offered to help put it from bullet points into kind of like a messaging to churches. But what would be the ask of churches? What are the things that they would have to think about in order to do this, so that when we go out, I'm going to talk to the Tacoma Ministerial Alliance on Tuesday, and so we reach out to other faith communities. How can we make a consistent request of how they might do this approach of welcoming into a space, whether it's a church-owned space or a church member space, an individual or a family, and provide them support. So that's kind of the framework. And then basically what I was hoping, in our groups, we can have those conversations, report back, but then just email it to me or Rob, and then we can work on getting that into a coherent approach.
Sure. So just to go over the instructions for folks before we go into breakout rooms, is there just a single question or two that we want everyone to try to address and then email us back?
Yeah, well, I think it's what would a congregation need to think of if they're going to welcome somebody into the house, and just taking the wisdom of everybody here who would think of, well, there's COVID restrictions, there's background checks, there's all these different things, so we can get them all in one place. So we can try to put together, I guess, kind of an FAQ for churches that this is what you need to consider before when you say yes to this.
Great.
Hey, Kevin, Carolyn here. Have you talked to Jan Monroe from St. Francis Cabrini? She's been doing this.
No, I have not. But if you could message me her contact information, I will.
Okay. Yeah,
And
she's been actually getting churches to commit to hosting a family or two, or rotating a family around to different churches.
Okay.
I'll look up her contact information.
I did not think it was an original idea, so it's good to know somebody out there is doing it, and I'll follow up with her. Thank you.
And just for further background, before COVID, she was a regular attendee at the coalition meetings as well.
Okay, very good.
So why don't we break out for, I'm going to set up 8 breakout rooms. Why don't we spend 15 minutes kind of going over thoughts responsive to Kevin's question. And then what I will do is we can put our email address in the chat afterward for folks who have taken notes during the meeting to respond back to us. So it'll take just a moment for me to hit the button and send everybody to rooms, and let's have a good conversation until about 10:13.
Yeah. If you could designate one secretary, that'd be great.
And just so you know, this is not one of the meeting rooms. So if you're hanging here, that's fine. To take a break from the meeting, we'll come back here at about 10:13.
No, I'm talking to you. They're talking to me. Hold on.
Good morning, Julian. We are in the midst of breakout room conversations. Do you want to go to a room or just kind of hang here until we're done?
Well, I don't want to go into a room. What are the choices?
So what they're doing is they're talking about how to what churches would need in order to sponsor families for throughout the winter until they can move into more permanent housing. I do have the first room only has 2 folks in it, so if you want to go there, I can easily send you there.
Before I do, what are the other rooms?
They're all considering the same question.
Oh, okay. So, sure. Send me to the one you suggested.
Okay, great. Thanks.
Thank you.
Just to let everyone know, in another minute, we'll be closing the breakout rooms and coming back here to hear what people's ideas were. Welcome back, everybody. It'll be just a few seconds here before everybody's back in the room.
Does anybody on here know how to change the name on the screen name?
So we have it locked down right now, but I can change it. What would you like me to change it to?
Just put Al.
Okay.
Al Quintana, Quintana. Just Al Quintana. Thank you. I logged in through my other account, so it showed up as my email, and usually it has my name on there from my work one, but I got in here kind of late. So
yeah, no problem. Did I spell your name correctly there?
Just Al, not Al. Take the A off and just Al Quintana.
L, got it.
Perfect. That'll
we'll
work.
Fix that right now.
Thank you very much.
Yep. All right, so why don't we do some quick report outs from the groups. Did everyone assign somebody to take notes in their groups? We can start with room 1, which was Charlene, Julian, and Kevin.
Yeah, and we had Teresa Powerdrudis on for a little bit until her bandwidth issues overtook her. So we had a kind of a broad conversation and kind of identified a few things. One, background checks with really a caution to do that on a case-by-case basis. It's really helped churches understand that they need to understand the person and the issues behind them. Though there are some, sexual offenders, some things that are just no-goes to start with. What kind of special behavioral health needs, mental health, substance abuse, how might they connect to the community to provide those supports, or to make sure the folks who are staying with them are connected with those supports if they can't do it. Are they equipped to handle children, and what special needs might that entail? We kept going back and forth between churches could do this in their parking lot, not as a whole safe parking system, but just one car. But really we're looking towards how can we help them find a way to house people in a structure. Make sure the church, as much as possible, can know what they're getting into before they do it. What are we asking them to do, or what is it that they're able to do? And we can do it for a week, we can do it for a month. We're really helping them do that process and not feel like they have to do what church A is doing if they're not able to do that. Really look again at the bias against RVs if they're going to welcome a person in a vehicle. That sometimes, particularly with kids, that's the best model. And how can you set that up properly? Again, I think we said this, but how long a commitment is the church making? And what are they capable of doing? And how might they have that conversation with the family they're welcoming ahead of time? So those are kind of the key things we had.
Great.
And I will email that to myself.
To yourself. That'll be efficient.
Yeah, thank you.
So room 2 was Carrie Ching, Judy Flanagan, Rita Lawrence, Valerie Knight, and Verna.
Morning. Yes, we chatted. We came up with some suggestions. I'll type them up and send it out. So one, really figuring out if churches are still meeting remotely, how are they going to support someone in person, sanitize and prep the space, restrooms, showers for everybody, providing items, soaps, cleaning, food, laundry rooms, transportation, blankets. We spent a good amount of time on services, how to make sure that everyone in a church has the proper services and connections to outreach, as well as access to a 24-hour outreach line. What we don't want to see, and we know it's going to happen, is somebody's going to have to be removed in the middle of the night or have a mental health breakdown, any of those number of things that can and will happen. What is that church supposed to do at 3 in the morning? And who is going to be there to support that church? So, and then the other big thing that we talked about was ensuring like a matching program. Like we know not all churches are fully accepting of LGBTQIA+ folks. And yet we know a large population of our homeless folks are LGBTQIA+. So we don't want to re-traumatize folks experiencing homelessness, but we know we can't change a whole church, right? Like that's not gonna happen. So we wanna make sure that people are placed in a space that they are accepted, wanted, and that this isn't turning into something it should not be. So that was a big thing that we chatted about for a long time, but I have a full 2-page list, so I will type it up and send it to you.
Awesome.
Valerie, can I say something real quick? Judy
Sure.
had a real good idea about, I think it was Judy, about creating some kind of an info session or, offering information to churches about the population that they might be serving so that their perceived expectations would more closely match what would actually happen if they were hosting people. And then, let me see, someone else said creating some checklists for church to help them see if they have the capacity as they're going through the decision-making process.
Great. So room 3 was Alan Brown, looks like AmeriGroup, Jennifer Amons, and Mike Yoder.
Alan, you want to take it? Alan Brown, we talked a lot about work that Alan and Nick are already working on to revitalize some of the core tenets of the old family housing network, which I think will be a beautiful model that that Kevin can roll out to other congregations. But Alan's doing the work. Can you briefly report on that, Mr. Brown?
Sure. Yeah, actually, Nick Leiter and I have been working on this for several months and identified a church that is willing to host one family. And we worked out policies and procedures with them. We have an MOU with them that was just approved this week, actually, and we'll probably get ready to start within the next few weeks, starting with one family. And what we're doing is drawing from our rapid rehousing program and families that have been referred to our rapid rehousing program. And there's always a period, of course, while the family is looking for housing, but may need shelter right now. So yeah, we are getting that started now, and we're looking at this as a pilot that we can learn from. I mean, we've tried to plan for all the contingencies, but we know that we're gonna learn things and have this pilot church be able to inform our future efforts, and they can even be a part of recruiting others from their own experience.
Awesome. Any other thoughts from that group? All right, let's move on to room 4, which was Al, Carolyn Reed, Maureen, Stephen Sprague, and Taylor.
Yeah, we had a few things to discuss, but I'll give you most of it in the notes. We thought to be a little careful of the language of how you title the program. Maybe not adopt a family, but maybe lift a family, build a family, ministering with a family, without getting too religious, so families aren't feeling like forced upon with the religion aspect. Also have shared housing, do some background screening, placement. I don't know if they do casework to get them housed, but maybe having another organization do the casework to get them housed. Another model we talked about is a sanctuary model, used like with immigration type of things, where you commit to one family and host them in a house or whatever, and put all your resources behind it. And also make sure there's rapid COVID testing available.
Thank you, Carolyn. Group 5 had Audrey, James Pogue, Rosemary, and Serena.
Yes, so let me grab my notes real quick. So we had a couple of ways we went, thinking about how different congregations can participate in either adopting families or people, as well as what they can do to provide ancillary support. So we talked about churches could like adopt a shelter or adopt an outreach team to provide like outreach donations, blankets, bags, clothing, tents, or adopt a shelter and put like a giving tree type thing. And then people could sign up for items that they need. And then the congregation could work with the shelter to get personalized kind of Christmas style gifts. Working with like shared housing to expand host homes using the existing model that already exists, where we do matching and sharing would be easier, so that the shared housing program would do the screening for the faith community, and there would be a little bit less of a learning curve on adopting a family through that process. Also, from the very first presenter talking about a place for people to cook their food, if a shelter or not a shelter, but if a congregation had the ability to offer hygiene support, showers, or places for people to cook food, that could be helpful for some of the people living without ability to cook. We also looked at, could a congregation adopt a family that already was in a shelter and use the shelter as kind of the screening criteria? We had the same concerns that Valerie shared about making sure trauma-informed care was part of it, and that not all individuals living in homeless shelters or in encampments are going to be interested to receive support from different faith communities, or if they are, would there be undue expectations or trauma put on by the faith community trying to do their best to assist the person, but also inadvertently causing more harm? So if there is criteria, whether they know them or not, we could rely on either the shared housing services or the shelters to offer kind of a level of screening, so we don't have some, let's just say, misalignment of expectations when we try to do housing options. The other thing we talked about too was kind of expanding our pool of faith communities. So some of this would be cold calling churches that honestly appear to have the bandwidth. So we would look not at the small churches that are really suffering during this time, but we would look at maybe mega churches or other large congregations that are currently not part of associated ministries or not a part of the coalition or haven't offered supports, and they could do the same thing. They could offer giving trees or something, or they could do the host home. The other thing we said is maybe we expand what churches mean, that we look at faith communities beyond just Christian churches, that we have a variety, depth and breadth of faith communities out there, that some that have come to our coalition and stood up and said they want to be helpful, and other ones that maybe they haven't come to the coalition, but have a heart to give back to the community. So expanding beyond just traditional Christian. So those are our suggestions.
Awesome. Group 6, which was Dana, Jeffrey, Oscar, and El Quintana.
Yes, we had a pretty good discussion. Jeffrey was saying a lot of this has been already done in other places, and it's important for us to maybe not reinvent the wheel, but just learn from others. We talked a little bit about my church many years ago, which has since closed, but it had kind of a very kind of a bad situation when we took in a homeless couple, and we allowed them to stay in the park, our parsonage in the basement. What we did wrong there is that, and that's the thing about the screening being so important, because the couple went in and we took rent money, and that was not a good thing to do. And the next thing you know, there was not 2 people, there were 12 people. And so we had to experience a costly eviction in that. And it, unfortunately, was an experience that left kind of a bad taste for some of the members of the church. So, and also perhaps setting it up to have a mentor church, kind of similar to what Alan was saying about they're going to start it off with the one church, and then as more come on, kind of a mentor role in kind of guiding them through and the common things that they're finding that are working or not working. So that's pretty much all we had to say.
Great. Thanks for that perspective. Room 7. This was Amanda, Colin, Gerald, Jan, and Nathan.
Yes. I think a lot of the stuff that has already been covered, we covered, but I would just quickly say education, education to the church was a huge piece, kind of a description of what homelessness looks like, the different phases of it. Really, I think kind of lessons learned and kind of what is a big piece of the safe parking network is just really having that support from the people that they do. So people from this coalition supporting those churches and just having someone to somewhat lean on. Clear expectation setting, I think that is huge. I think oftentimes we go into these things and so expectation setting was said, and then in my mind, it's super important to always understand, what does success look like? Now, if you're doing one family, does success look like 2 different things? For one, is it letting that family stay as long as they can? For the other side, is it getting that family housed within a month? And if they don't, then it's not successful. So I think having that clear expectation of what success looks like. I think a key piece of this is, can it be financially supported? I think churches are strapped right now. So really, I think it's kind of that thinking outside the box way of looking at, what does the church have to offer? What are assets that church has? Obviously, examples are parking lots. We're looking at safe parking in those parking lots, but oftentimes those parking lots can be used for tiny houses. Can we get 5 tiny houses in a corner of a parking lot or on your parcel? So I think it's really looking at what are the assets and how can we financially support that church. Got to speak to the mission of the church. This is the practice of your mission. I think really tapping into that's something that's also come up with the safe parking network is huge. And then like I said, I think just being open-minded and thinking outside of that box, as everyone has said, but it's, the idea of, well, maybe that church has a widow who has a big house and they would be willing to buy the family. And so that right there is, okay, well, that's, so I think that's a little bit outside the box, but that shared housing idea, obviously making sure we're checking all the boxes and everything. But yeah, that's about all we have.
Thanks, Colin. And then group 8, which is a small group, Lori and Paula.
Okay. So some of the things we talked about are the essentials that the church needs to realize. And so this would be some sort of information we would give to them of the options. So maybe a checklist or something that says, are you going to be doing this for 12 hours? Or you're going to be doing it for 24 hours? You're going to do families, you're going to do individuals. How are you going to feed them, or are you going to feed them? Restrooms, security, different things like that. All of those choices that the churches can make with this network, the Safe Parking Network information that we have, it's up to the church how much or how little they want to participate. So I think that that's a really good thing, but in order to help them understand that, we can use some experience. So one of the things that we were going to that we were looking at is offer training, which I think that's already been mentioned. Vallejo does training in de-escalation and trauma-informed care and other things, and that would be a good partnership too, to have Vallejo help us with training on a church. Also, Freezing Nights, as you know, was going for 17 years. We have training in Freezing Nights every year. All the volunteers get trained, and it also talks about de-escalation, how to handle homeless, different things of that nature that might be useful. And then one of the other things that we came up with is if you have a few churches that are going to do the 12-hour and a few churches that are going to do the 24-hour, can you create some sort of church co-op so that they can learn from each other, as well as after we've given them as much training and information as we can. The 12-hour churches would maybe have some different needs and support needs than the 24-hour church. If you're doing families, are you going to be connected, and can we arrange for connections with the school districts to make sure that the students have a place possibly in the church to be able to do school, and then also the tools, a laptop or an iPad or whatever it is that they need. So the connection with the networks and the service providers and the school districts, if they're doing families, things of that nature, are going to be really important. And so probably it would be good for those of us that are in the service provider field to be able to help them with those connections. Maybe we just introduce them and then pass that on. So those are, and then the last thing that I thought of, I don't think I mentioned it to Lori, was one of the churches that I am currently bringing the New Hope Mobile Resources Response Team to is also considering doing safe parking. What the first question she asked me when I said that to her was, can you get your church, which my church is close to that, can you get them to send us some volunteers? So this is one of those smaller churches that we were talking about. And so I think it would be really good also to somehow develop a list of churches that maybe don't want to put it in their parking lot, but could have people interested in volunteering and doing that, helping other churches that are. So those are resources that are very valuable. And I don't know, Lori, did we have anything else?
Yeah, the only thing else we talked about a little bit was giving churches ways to deal with neighbors who don't like the idea of what you're doing. We experienced that here at United Methodist where our office is, and it can be really, as you know, where you are, even more so. It's just really frightening sometimes, the amount of opposition there is, the harassment that takes place. And I think if there were a way to, give people some ammunition, maybe do some marketing about, why this is not scary, why this is a good thing, will be really helpful.
Great. So all of these suggestions, if you get the opportunity, please email them to either Kevin or I. If you send them to me, I'm going to end up bumping them over to Kevin. So Kevin's email is in his chat name there. He can put it in. Do you want to put it into the chat as well?
I already did. Somebody had asked,
okay.
So I put it in the chat.
Great.
And thanks, everyone.
Yeah. All right. So we've got a couple of items still left in our agenda today, including running through our government updates. So why don't we get started with those? Valerie, do you want to offer an update from Pierce County?
Sure, yeah, I'll offer an update and then I have to jump off. I actually have a scheduled call with MDC at 10:30, so I'm a little late, but that's okay.
I can't get in the way of that.
I'll blame Rob. So I've been out for the last 2 days, so if you have an email, I'm getting back to it. I had some medical appointments, so I'm back today in full force. But so updates on rental assistance. For our ERAP, we have served 1,451 people, or households, I should say, it's households, for a total of $3.2 million. And that is a complete spend down to date of 39%. And then for CARES, we have served 1,914 households for just over 4 million. And that is a spend down of 55%. And that includes the new $5 million that was just put in a couple weeks ago. So we have served a total of, however many added that up because I didn't do it earlier. We actually just implemented 2 new things, which is very cool. So we have contracted with Pierce County Housing Authority and Tacoma Housing Authority to do direct service to their households. So we gave a chunk of money to both housing authorities, so they'll be able to serve their low-income households directly. They won't have to go through the portal. It'll be very fast to help support all of those households in low-income and subsidized housing. And so that contract just went out Tuesday, and then we are finalizing it today. So that's a quick moving change that we have implemented. We did hear back from the state. We have access to the last 50% of our ERAP dollars, which is great because there was that worry that they would take some of it. They're not. And they actually asked if we wanted any more. And so we're working with the state to see what the needs are. And we have implemented up to 6 months of services through ERAP. CARES is going to stay at 3, but we'll do a warm handoff if there's a need to for anybody who's being served through CARES. I will have your demographic report for you next week. Actually, Jeff Rogers will because he's back. He will have your demographic report for you next week. So Jeff Free, our data team, is working on finalizing that report right now. So other than that, we are just rocking and rolling. The big question we get all the time is, have we been extended past 12/30? We have not. These dollars must be spent by 12/30 and invoiced the very first week of January. So if that changes, believe me, you'll know because I will be so excited. So that's what I have for today.
Thanks, Valerie.
You're welcome.
Do we have anybody on today from the city of Tacoma with an update? I'm not seeing anyone. So let's move on to the Tacoma Pierce County Health Department. Carrie, any updates?
No, I think Jack's covered a lot, but I sent out an email yesterday with the flu and COVID mobile schedule, and I'm going to put in the chat box the Pierce County's COVID mobile testing schedule as well, because it tells you whether it's walk up or drive through for just COVID. So I'll be doing that in a second. Thank you.
Thank you, Carrie. And I don't see anybody from the Pierce County Emergency Management Office with us. Is there anyone here with an update from that group? All right. So that cues up Maureen to talk about advocacy and whatever she would like to share with us this morning.
Thank you. So I think we can wrap it up probably fairly quickly and leave people some time this morning. At the national level, there is no relief in sight. You know as much as I do from watching the news and reading whatever tea leaves you read. It doesn't matter how desperate the need is until the Senate acts on a relief bill that has some parity with what has already passed the House and that Trump is willing to sign. There will be no relief at the federal level. Absent federal relief, this will simply be horrendous coming the 1st of January. At bare minimum, we need an extension of the CDC moratorium. Will we get it? I don't know. We have a gap from the end of December until January 20th, when President-elect Biden takes office. And hopefully in that stack of executive orders is something that begins to address the needs of people experiencing homelessness or at the brink. At the state level, the governor's office reached out to the Washington Low-Income Housing Alliance and said, what about shelter needs? Because everything the Alliance was putting forward was about housing, which we all know that it's a desperate situation, or about rental assistance, but not actual shelter. So everybody's kind of scrambling to try and figure out, are the shelters set for the winter, the existing shelters? Are they set, are you set on into 2021? I see at least one head saying no. So I'm going to be following up with some of you, in small groups to try and get your status. And I understand, I ran nonprofits, I ran shelters. I get it. If you declare that you have a need, you look weak. This is not what needs to happen. You need to be able to say, this is what we have to have going through this winter, going into the coming year. We are living in this pandemic well into next calendar year. And that's just the reality of it. So if you're running a shelter, look for an email. If you don't see one from me, please reach out. Now, the legislature will have its regular working sessions, its pre-legislative session, November 30th and December 1st. And we'll get some idea of where the legislature's interest is going forward into that session. And so will be a range of, the whole lot of advocates will be watching what are the homelessness issues they're highlighting, what are the housing issues they're highlighting, what are the supporting service issues they're highlighting, so that we get some idea. Now, we know from a call earlier this week that, so some of you probably followed the University of Washington and King County Human Services study on the folks who moved from DESC, the huge congregate shelter in downtown Seattle, into the hotel rooms immediately when we realized how the pandemic spread. And so they've got a research project, and they've been presenting findings, their report, since Housing Washington and the Homelessness Conference. And they've been asked by Senator Kuderer to present to her housing, and I forget the rest of the name of it, committee in the Senate during the working days. So that's getting increasing visibility. I know some of you are working on trying to expand your congregate shelters again. Please, please be very careful on doing that. We've been really lucky in keeping the incidence of COVID down, I think, pretty low with respect to all of the homelessness work that you all are engaged in, and we need to keep it like that. So if you're not paying attention to the emails the messages I'm forwarding from the Washington Low-Income Housing Alliance, I encourage you to do that, because these webinars that they're providing as preparation for the coming session are really good, and they're free, and you can just click on them and watch them anytime. So, and spread that with your friends. It's a particularly I think it's particularly important to watch the one on the Housing Trust Fund, so that people really understand the State Housing Trust Fund. So there's a level at which it's all really pretty amazing to me that we have such an enormous State Housing Trust Fund. Remembering when we stood in committee rooms and the lenders in the state of Washington told us we would bring down the lending system, the banking system in the state of Washington, if we went forward with just trying to get the interest on the real estate escrow accounts. So to look at the potential of $250 million new dollars as the request for the State Housing Trust Fund on top of everything that's there, it is really pretty astounding. And if you are young in advocacy work, so it's a long haul, but there are moments of wonder in it. And there are people who are wonderful in it. I sent out the first tribute on Tony Lee. If you knew Tony Lee, then you know everything about him, except maybe that he didn't know how old he was. But if you didn't know Tony Lee and you're working in homelessness or any poverty issue in Washington State, you are doing your work because of what Tony Lee did with the Washington State Legislature. He was the smartest, kindest, funniest just incredible person. And he taught everybody all the time. Tony never kept a secret about how to do something or make something happen. Tony shared that so that you were always more prepared for whatever you were going to do after Tony talked with you, or after you shared a stage with Tony, or you followed Tony in your testimony, whatever it was, he shared it all. And it just made a huge difference in all of us who were fortunate enough to be able to work with him. So if you want to be an advocate, be a Tony Lee advocate. All right, other things. We are going to have a new county council. And so we need to think about how we want to work with them. We still have some time. The City of Tacoma budget, I sent out the neighborhood and community services information. You all may have some questions on that as well. This budget's pretty far down the line, but that doesn't mean that we can't ask for clarifications, and we know there'll be modifications as we go forward. We've got a number of coalition working groups, and one of the things, which is really pretty exciting, but one of the things I really want to ask everybody, if you've got a working group that you're part of and everybody in that group looks like me, then go looking for some other folks who don't. That's our job. And it may be, everybody's got a lot to contribute, but not everybody knows how to get to the table they want to join. And so please take a look and go looking and ask the folks who represent other communities to help you do that. If you're coming like I am from a straight white elderly community, highly educated, lots of privileges over life, then reach out to some folks who don't have that same profile, and let's get these working groups broadened. The other thing is we've got a brand new state senator, Twana Nobles, and so we want to get ready to welcome her and work with her. We've got a brand new state senator, but not new to the legislature, and Chris Gilden from Puyallup, same thing. We got to be able to work with him. We did not get some of the people that we wanted, but we thank them for, I hope Larry's still on. We thank them for running, because that's huge. And we want to help them figure out how to do some of the things they wanted to do by running, even though somebody else actually won that race. Let's see. So there are two things that are really hard, I think, to talk about still this morning. One of them is that we've been really focused on ERAP and the county's CARES money and the veterans program money, and now the money that's going directly to the housing authorities for rental assistance. And that's really critical to keeping everybody who is housed. And even so, that's only a sliver of what we actually need. We're going into 2021 with almost no assured rental assistance money, unless the feds act or the state acts, or we are able to scrape some money out of like community development, block grant, CV allocations. We're not going to have rental assistance money in any amount that we need. So we're going to be faced with, do we want funds going into keeping shelters open and even opening more? Do we want funds going into the support services that we know are so critical? Or do we want funds going into people who are at the brink of losing their housing? These are going to be really horrible decisions for us to have to weigh in on, but we need to think about it, and we need to use that reality as the impetus to lobby in every way we can for the state to come forward with funding, even if it means additional document recording fees, if it means some kind of a progressive tax. If we did nothing but tax the transactions of the, mega mansions. That would be something. Or the people who own them. And I know your organizations will have different positions, and so will you. But I urge you to listen to everything that's put on the table as thoughtfully as you can. And you can always act as an individual, as long as you're not a Fed. There's some Hatch Act things that preclude you if you're a federal employee. And you may have restrictions through your nonprofit organization. You may have to use your own phone. You may have to use your own personal email. You just need to know what the policies of your organization are. You may have to, if you sign a petition or any kind of a sign-on, you may have to sign as an individual, or you may have to note that your organization is for identification only or something. You might have to be really careful. And some of the nonprofits may be able to take positions that are much more public. So, and if you have a network, like I see Mike Yoder, and I'm not sure who else is heading a network here, Reverend Boyce is on with the Episcopalians, you may have the capacity within your structure to be able to take more public positions or to guide the members of your structure. So these are all things. Now's the time to get those pieces in order and figure out what is it that we can do, that we need to be able to do, that we need to be ready. What is it we already know we need? We need good data. We need to know how to present it and how to explain it and defend it. And we need stories. We need stories of the people who are impacted by the absence of the resource or who have benefited because of the resources. I don't think Kelly's on the call, but think about Kelly last year talking about the 49 childcare facilities she called to try and find childcare for her 2 boys so she could go back to work. And how when she finally got childcare, they were at opposite ends of the city of Tacoma. So just, look for people who are willing to tell their stories. Look, the Alliance will help them learn how to do that. You yourself may have a story. So think about, are you ready to tell that story? The only thing you can't do is you can't tell somebody else's story in a way that identifies them. That's a story held in trust. But again, we can help you do that. So like Garrett was going to talk as part of Associated Ministries program last night, and about people who live with chronic mental illness and are homeless. And I said, oh, don't forget my friend who pours the vitamin C on the trees so that pours orange juice on the trees so they get their vitamin C. You'll never know who that person is, but that sort of brings it home for me, and a lot of other stories held in trust. Here's the other awful thing. I think, and I haven't had the courage to double check, but I think a lot of people who were in that first wave of layoffs got those first unemployment benefits beginning in late March, may now be bumping up against the end of the combination of their state and federal unemployment benefits. I think it's 26 weeks for the state, plus they got an extra 13 under the CARES Act, under the unemployment part. I'm hoping I'm wrong, but if I'm not, we're going to start seeing a whole new group of people who don't have that income, because no matter how low it was income. And so that's going to start to affect people's ability to remain in housing. And on that awful note, you know how to find me. So please do. And if I don't respond right away, keep at it, because you'll bubble up on the list, which seems to have gotten more burden lately. And we'll talk about encampments next week, hopefully if we have time, because on this county contract that I have, one of the things to look at in 2021 are self-managed encampments, safe encampments. I'd like to live in a world where we weren't spending any time trying to figure out how to make people living in tents safer, but that's not the world we're in. And I thought Nora did a wonderful sort of intro to that this morning. And so think about what she talked about and how the Catholic worker community works with the folks who are living in tents and in vehicles on their street, and what of that attitude, what of that experience we can adapt. Many of you are outreach workers, or you know the outreach workers, folks who are going out to the encampments. And so how do we help people be safer during this winter in the midst of this pandemic? So as always, it's an honor to do this. Thank you.
Thank you, Maureen. So we have a couple minutes left. So I'll open it up to anybody who has items for the good of the order. Nathan?
Oh, yeah, I've got one. I don't remember hearing anybody talk about the fact that we had a homeless person pass from exposure in the last week out here. It's the first one that we know of for the season. That story is going to be the narrative of the season for us. Like we're going to have a lot of that, right? So I don't know if anyone is, and it's always a terrible thing, right? It's tough to talk about a tragedy as a political opportunity, right? Because it is both things. Like it's awful and it's inhumane and it's shitty, but we need to be using this to talk about the fact that it is an emergency. People's lives are on the line, and not in the figurative, but like literally people are dying because of a lack of action, right? So however folks want to take that and run with it, like that's on them, but like it's already started, and I think that we need to be talking about it.
Thank you.
And thanks, Nate, for bringing that up, because I meant to mention it. I did confirm with the police department that a gentleman experiencing homelessness died on November 5th. I was on a porch of an abandoned house. Natural, as it were, causes, though I don't know how natural that would be. One thought I had, Michael, back in the day, Associated Ministries, and it's harder to do now with COVID, used to do moments of blessing at scenes of homicides. And I'm wondering if there might be a way just to bring in the church community to do a moment of silence or blessing at this spot where this gentleman passed, and if that should happen again, just as a way to bring it into the
we're open to
community
doing
consciousness.
those. Yeah, we'd be happy to organize that. We in the days of Ron Vignac, and then we tried beyond him to keep it going and just automatically show up at the site of every death, but we just haven't had the bandwidth, and it kind of came down to only me and the staff member who showed up, but the majority of the time were there, so there didn't seem to be the community interest to keep doing it, and we didn't need to do it for ourselves necessarily. But if there's a community desire to have a moment of blessing type remembrance, then we'd be happy to, to bring our help in staging that. And we still have a email list to get the word out, to show up and to do that kind of commemoration. If there's we've been waiting for the community to ask us to do it now instead of just proactively doing it.
I think it'd be a great idea.
I don't know if we can actually show up.
Well,
so we'd have to
maybe stand in a circle 6 feet apart or something. Yeah, it's challenging.
Yeah.
There might be something, maybe Dr. Christopher, I keep thinking back to his coming to the coalition meeting and really having a real commitment to people who were living unsheltered. And maybe that might be something that the TMA might be interested in partnering with.
Well, I'm speaking with the TMA remotely, of course, on Tuesday, so I'll add that to my list of things I bring to them.
Well, and I know Mike has a really good relationship with Dr. Christopher, so.
Yep, let's mention all of us can be mentioning this. It'd be a beautiful, role for them to take on. I think a lot of the tragedies of deaths on the streets may be, within the central city area. I'm just going to guess. So there'll probably be TMA member churches nearby, and if they want to, embrace that, within their neighborhoods, I think it'd be a beautiful expression.
I think this gentleman, the place where he died is actually not far from the tiny houses there on McKinley. I think he was at the 800 block of 56th, East 56th. I think that's not far, although my geography over there is imperfect.
So anyone else with items of general interest for the group before we move into our planning portion?
This is Julian. I'd recommend if anyone, I've discovered this recently, you can actually save the chat discussion to your hard drive if you don't want to lose all the data in it, because when you leave the meeting, if you haven't done it already, you'll lose that data. Thanks.
Thanks, Julian. And I know we've got a smaller group of us still here, but just a couple of reminders about scheduling going forward. We're not anticipating holding a meeting on November 27th, which would be the day after Thanksgiving. So that will be the first of our holiday breaks from the coalition. And then in December, Christmas and New Year's both fall on a Friday. So we won't have meetings on those 2 days. So as always, feel free to stay with the call if you'd like to help with planning for next week's meeting. And hope everybody has a good weekend and a safe weekend, and see you all next week.